How do you know if a bacterial STI is reinfected or treatment failed? Figuring out if a bacterial sexually transmitted infection is a new infection or a treatment failure can be tricky. It involves understanding how the infection responds to antibiotics, your sexual activity after treatment, and follow-up testing. First, it's important to know that treatment failure means the antibiotics didn't fully clear the infection. This can happen if the bacteria are resistant to the medication, if the wrong antibiotic was used, or if the medication wasn't taken properly. Reinfection, on the other hand, occurs when you are successfully treated but then catch the same infection again from an untreated or new partner. Symptoms alone are not reliable for telling the difference because many bacterial STIs like chlamydia or gonorrhea can be asymptomatic or have mild, nonspecific symptoms. Testing too soon after treatment can also be misleading. Some tests, especially nucleic acid amplification tests, can detect bacterial DNA even after the bacteria are dead. This means a positive test shortly after treatment might not mean the infection is still active. Usually, healthcare providers recommend retesting at least 3 to 4 weeks after completing treatment to confirm the infection is gone, unless symptoms persist or there's concern about adherence to the medication. Your sexual behavior after treatment plays a big role. If you have unprotected sex with untreated or new partners soon after treatment, reinfection is more likely. If you have abstained or used protection consistently, then treatment failure should be considered. It's also crucial to treat all sexual partners at the same time to prevent reinfection. If partners aren't treated, the bacteria can be transmitted back to you. Follow-up testing is recommended for some infections. For chlamydia and gonorrhea, retesting about 3 months after treatment is advised, even if symptoms are gone. This helps catch any reinfection early. A test of cure, which is testing shortly after treatment, is generally only done if symptoms continue, reinfection is suspected, or there's concern about medication adherence. For infections like syphilis, blood tests are used to monitor treatment response, and if antibody levels don't decline as expected, it might suggest treatment failure. Persistent symptoms despite proper treatment should prompt further evaluation. This could mean antibiotic resistance or an alternative diagnosis. In summary, distinguishing reinfection from treatment failure depends on timing, sexual activity, partner treatment, and follow-up testing. Always consult your healthcare provider for personalized advice. They can help interpret test results and decide if additional treatment or testing is needed to keep you healthy and free from infection.